Hey guys, welcome back to my channel. Today's video is going to be on discouraging comments when it comes to nursing school. If you guys are interested, let's get into the nitty-gritty. So I want to start off with a little experience that I had when I first got started in my program. I started in an accelerated program, which was only for 1 year because I had a bachelor's. But the orientation in general had all the types of programs they had. They had a regular option, like a generic, a transitional option, like if you were prior to nursing school, like if you were an LPN or something like that, or an EMT, then you can do a transition program. They had all the programs in that one orientation. So I was sitting in the back of the orientation because I'm not one to be in the front of the class kind of thing. So I was sitting in the back, and one of the professors just walks over, and I didn't know who she was, she didn't know who I was or any of the other people in my row, and she's like, oh, let me ask you guys, were any of you CNAs or nursing assistants or have any sort of hospital experience? And for the most part, the people in my row said yes, and I was like, no. And then she's like, well, then you're gonna have a problem in this program. And I looked at her like, really? And then she's like, yeah, you probably should drop out kind of thing, get the experience and then come back. It'll be beneficial for you, and you're gonna see in the long run that you're not gonna have as much problems. So that was like in orientation. So right off the bat, I was pretty intimidated by the program itself. And on top of that, a lot of people had told me that nursing school was hard. But in my mind, I was like, if I set my mind to it, I could do it. Anything I set my mind to, I can achieve. So that's what I did, and that's truthfully what happened. So what I want to get out of the way is that you shouldn't let people discourage your dreams. If it's your dream to be a nurse, then go for it with everything you have. Everything you've got, put forth, and you'll do it. It's just a matter of putting in the work. So like if you're kind of like half-assing it, then yeah, it's not gonna work for you. But I'm gonna just put right off the bat, if they tell you that you need hospital experience or you need to be a nursing assistant prior to nursing school, that is not true. Sure, it would help, but I didn't have that at all, and I did just fine. You have to have faith in your nursing school itself and the clinical sites that they provide you, that you'll get a good amount of, that clinical nursing experience. As it is, I mean, in my mind, I should have just told her, well then, what's the point of school if they're not going to prepare me for this? You know what I mean? Like, come back at her like, I got this, or your program should teach me enough, But I didn't. I'm obviously very timid and non-confrontational, so I just kind of kept my head down, and I was like, well, I hope that, she's not trying to come for me, like if she's one of my actual professors. She never turned out to be in my program, but I had heard she was a nightmare. Anywho, so that's one thing. If they tell you that you need nursing experience, you don't. I mean, I'm not going to be the one to tell you, like, just don't go into an interview without anything, but if you don't have anything, don't think of yourself as less worthy or less of a good candidate. Because if you have it, if that's something you want to do, you'll do it. And as a matter of just getting into nursing school, I'm sure that you have other attributes that work in your favor to get you into that program, not just the experience that you may or may not have. Another discouraging thing that I experienced was that I was going into a program that was an associate's degree. So then what so many people told me was that is a waste of time because all hospitals require a bachelor's degree. Granted, that's been the trend, but that's also not true. Not all hospitals require a bachelor's degree. Sure, they would prefer it. Don't get me wrong. Every hospital would prefer it. If it was up to every hospital, I'm sure they would ask for master's degrees. But my point is, you can get an associate's degree in nursing and still succeed. There are still nurses out there that only have an associate's degree, and they've been practicing as nurses for many years, and they haven't had any problems. I'm sure if they work at a magnet hospital, they may have been approached to get their bachelor's in a certain amount of years, but it doesn't mean that they're going to lose their jobs. There's a potential if they, after the grace period that they give you, sure, but they're not implementing it and then today you're gone. They give you time. I joined the magnet hospital with an associate's degree, and I signed a contract that I would get it in 5 years, my BSN. And I did it in 1 because I didn't want that pressure on my back. But I think that's honestly the smartest approach to nursing. Hear me out, because if you're going into it like you want to be a nurse and you've always wanted to be a nurse and you do your pre-nursing and your nursing, then you did it. You're on your way. You're probably, by the age of 22, establishing yourself as a nurse. But if you did something like how I did it, where I wasn't quite sure what I wanted to do, and I did a bachelor's in something else, and then I decided to join nursing, like if nursing as a second career, excuse me, I'm so sorry, nursing as a second career, then I don't think that you should do another bachelor's degree, because that's not necessarily 4 years, because they may apply credits that you already had, but that's time wasted. So don't get into a bachelor's program if you already have a bachelor's. I think that you should do how I did, where you do an accelerated option nursing program, get your degree, start working, and then finish your BSN online. Very simple. You already have your job established. It may be a little difficult to find a job because nowadays the BSN is kind of like a high school diploma when it comes to nursing degrees, but it's not impossible to find a job. And if you have to settle for a job that's maybe not where you want to be at first, maybe in a hospital you don't want to be at, that's okay too, because all you need to do is put in your time, get your experience, finish your BSN, and then you can transfer. You can always look for other options if you have the experience. So let's say you finish your bachelor's, you finish a 1-year experience in a med-surg unit, and you want to go to the hospital of your choice. Then you can apply as an experienced nurse and start probably right away. So there are options. Nursing is very, very accessible. There are a lot of options when it comes to work. Like if you don't want to be a bedside nurse because you can't deal with bodily fluids, that's okay too. There's also nursing informatics. You can do like the behind the scenes where you're developing the software for the nurses, but you are a nurse. Make sense? So I think that the discouraging comments may kind of push you away from what nursing is in general, but I think that it's such a beautiful career and it's so open that you can't let those negative comments get in your way. You have to be stronger than those people, like emotionally, not like physically. But if you don't let those negative comments in, then you'll be fine. But there are some people that do let that affect them, and they may think, okay, maybe I should just, get a job as a secretary or a CP, or, become an LPN first or something like that before I become a nurse. But that's not necessary. Honestly, it's going to be a waste of time, because your program should prepare you enough to be ready to be a nurse. Another thing I heard, or word of mouth, is that you have to put in your time as a med-surg nurse. Hear me out. I do think that it's a good amount of experience for you to do med-surg, because you're exposed to different disease processes and different diagnoses, and you're able to see more of a bigger picture in nursing, because you have several different types of patients in one day, for instance, and you have different types of patients too. My opinion, this is my channel, so really it is all my opinion, is that if you're not interested in dealing with that amount of, that caliber of patient, like that size of patient load, let's say 1 nurse to 7 patients or 8 patients, I don't know how many, some places are different, but if that's not what you're interested in, then that doesn't mean you have to be a med-surg nurse. Sure, people look at that as your experience, but you could get right into an ICU if that's what you want to do. It's not going to be easy because there aren't that many places that want to hire new grads right off the bat into an ICU, but it's not unheard of. So if that's what you want to do, aim for it, shoot for it. That's what I wanted to do, but I also limited myself to where I wanted to work. I wanted to work at this one specific hospital or hospital chain, if you will. So I limited myself. I got into a unit and I stuck with it for a year, and then I transferred out to where I wanted to go. So, you may have to put in your time in med-surg, but it's not necessarily like a prerequisite to any field you want to go to. Let's say you want to do OR or women's or PACU. You don't necessarily need med-surg. So get that out of your mind. Like, I have to work in med-surg in order to, succeed in the nursing industry. That's not true. Yes, there are more med-surg positions when you go to apply, but there are so many nursing positions open because there is always going to be a shortage. The older we get, the sicker we get, the more there is a need for healthcare. And as it is, we are living longer, so healthcare is always going to be a necessity. And there will always be nurses. Always, always, always. So if you're on the fence about whether or not you should be a nurse, this is also a video telling you that you should. Because there's job security and there's so many options. I've said it more times than I can count on where you can go in nursing. The bachelor's degree in nursing is just the beginning. It's literally just the beginning. If you want to just stick there, at your bachelor's degree and grow in your unit and spend 25 years in your unit, do that. That's fine for you, because then in the end, you're going to cap out on your salary and you're obviously an experienced nurse. People are going to look up to you, and you may even open yourself up to administrative roles in your unit. There's always room to grow. So I think you should become a nurse. Another thing that I've heard is that if you want to be a nurse, you have to be able to tolerate the 12-hour shift. Also not true. Yes, there are more positions in hospitals that are available that are 12-hour shifts, like AM or PM shifts, but there are places that have third shift options where you split it in 8-hour intervals. So if you're not someone that can tolerate the 12-hour shift, that's okay too. So if you can't tolerate a 12-hour shift, that's okay. Don't be discouraged thinking like you can't work this job because of the long hours. There are long hours no matter where you go, because even 8 hours is a good amount of time, but you don't have to work 12-hour shifts in nursing. There are places in surgical suites, there are places in standalone offices like a pediatric office or a primary care office that have nurses that don't work 12-hour shifts. So that doesn't necessarily mean that you have to work 12 hours because you became a nurse. That is not true. So get that out of your mind and think, if you're not someone that can do a 12-hour shift or work in a hospital setting, then nursing isn't for you, because there are so many options. I can't say it enough. I really can't say it enough. My last discouraging comment is that if you are fresh out of nursing school, you have to work night shift. I have my own opinions about night shift because I am a night shift nurse, and I've been a night shift nurse going on almost 3 years now, and I personally love it, but that's because I don't like to wake up at 5 in the morning. That's just not for me. It hasn't ever been. I remember in high school, it was the worst, literally the worst time of my life to wake up that early for 4 years. So if you absolutely cannot work night shift for whatever reason, let's say childcare becomes an issue if you do nights, there are places, like I said, that you can get into that will accept you right off the bat into a day shift position. Granted, I've said it before that I do think that you should put in your time in nights because there are less resources, so it's easier for you to navigate the field with less availabilities. Like if on day shift there's more doctors, more nursing assistants, or more of whatever, more managers, more administrators, maybe you have more hands on deck, more help, versus on nights it's not necessarily the same. It's less foot traffic, there's definitely less going on, so it's kind of a different environment. Sometimes I feel like as a new grad, doing nights may be better for you, because since there is less foot traffic, less orders going in at that hour, you should be able to take in that kind of workload and get a feel for how you'll, tolerate your 12 hours, and then maybe you can move over to days where it's a lot more hectic. And I say a lot more hectic because there's just a lot more going on. It's just a totally different atmosphere. But I do think you should put in your time on nights, but if you can't, that's okay. Don't be discouraged about becoming a nurse because you have to put in your time on nights. That's not necessarily true. All right, guys, I think I've said enough about discouraging comments and not letting that interfere with your career and your future. Just take it in stride, accept their feedback, maybe not even, don't let other people's opinions affect you and things that you want to do in your future. Anything that you set your mind to, you will achieve. All right, guys, that's it for this video. I hope to see you guys in my next one. Bye.